This program was a very successful program online. Last year, we had 356 people participate. We had over 130 people register for this morning. We've got some no-shows, but we're also live broadcasting this both on Comcast and at Eagle County TV. So hopefully a lot of people are able to join us. Certainly a topic that everybody's interested in. I just have a couple of quick announcements. One, I want to remind everybody to please put your cell phone into the silent mode. Thank you very much. This is the second to the last program for the Vail Symposium's summer season, which started back in May and goes through next week. Claire will talk about that. We're working very diligently to finalize our winter season. We'll have 20-plus programs, and we'll be announcing those in the next week or two. I just want to thank a few of the people that make it possible from the symposium end. First of all, we're really always pleased to partner with Chris Romer and his team at the Vail Valley Partnership on 2 to 4 of these programs a year in our Speaking Locally series. People who make it possible for us are presenting sponsors, the Frechette Family Foundation and the Town of Vail. Our event sponsors, Vail Resorts Epic Promise, the Vail Daily, and the Antlers at Vail. So we want to give all of those people a quick round of applause. We hope that we will have about, I think, 12 or 13 in-person programs this winter, everything continuing to move, hopefully, in the right direction, and then probably about 8 virtual programs. I'm now going to turn it over to our Director of Programming, Claire Noble.
Thank you, Chris, and welcome, everybody. This is our 22nd program of our summer season. Next week is our 23rd program. We're probably going to need to call it something else if we're going into November, calling it our summer season. 51 speakers, 18 of those speakers were local speakers. So we really appreciate all of the support we get from our local community, certainly from the VVP, Colorado Mountain College hosting our programs, and the Eagle County government filming our programs and live streaming it. Want to tell you about one more program we have in our summer season. That's next Thursday, November 18th. We welcome Bruce Jones. He's a fellow at the Brookings Institution, and he has a new book out called To Rule the Waves. It's about U.S.-China competition on the high seas, and essentially whoever rules the waves rules the world. It'll be an interesting program if you're interested in U.S.-China relations. That's next Thursday night. It's an evening program at 6 o'clock, and we'll be right back here at Colorado Mountain College. Tonight we have a distinguished panel of our county's top leaders. We have the Vice President and Chief Operating Officer for Vail Mountain, Beth Howard. We have Jeff Schroll, the Eagle County Manager. We have Will Cook, the President and CEO of Vail Health, and Phil Qualman, the Superintendent of Eagle County Schools. And moderating today is Chris Romer, the President and CEO of the Vail Valley Partnership.
All right. Thank you, Claire, and thank you, Chris, and thank you, everyone, for taking the time out of your schedule to join us, and thanks for our panelists for doing the same. We appreciate all of you guys, and we appreciate you taking the time to join us today. We even appreciate Michael Holton out in the back, waving like Forrest Gump every 30 seconds. He's doing the Forrest Gump wave from the boat there. So thanks, Michael. We appreciate you, too. Claire introduced you guys individually with your titles. I think a lot of people are at least familiar with the roles that you guys play in the community. Let's jump right into some of these questions, and we will have time for audience Q&A as well. We're hoping to have about 30 minutes to have answers and Q&A from you guys as well. We tried to hit on some quick themes in advance. So as we jump in here, as we reflect on the past 20 months, we'll call that the COVID era. What does normal look like moving forward, and what adaptations do you think will be permanent? We'll start with Beth, and we'll work our way down. And so again, what does normal look like moving forward, and what adaptations do you think will be permanent?
Okay, thanks, Chris. Great question. Good morning, everyone. It's great to be here. I don't know what normal is, and I've kind of gotten over normal. So I think one thing we've learned through the COVID era, as you defined it, is that we're incredibly agile. and are open to reimagining and innovating anything and everything we do. So I think that's a real positive attribute coming out of all of this that we've been through. I just want to touch on last winter and summer, and then of what's coming up on Friday, which is our opening, is a teaser. So last winter, as you know, we were here. We were on this format virtually, and there were a lot of things swirling around, a lot of uncertainty. How are we going to run a mountain in a COVID environment with all these new protocols? And our mission was to open and stay open and do it safely and have a full season, and it was mission accomplished. But we couldn't have done it without the commitment of our community and our leaders and our employees, all of us who were committed to have a season. And thanks for your patience, because I know everything was different and somewhat inconvenient on the mountain last year. So many lessons learned. What we're doing this year as we go into winter is saying, when we reimagined how we operated the mountain last year, what really worked well and what do we want to adapt going forward, and what things do we just want to let go and continue on. So as we look to this winter, Friday is our opening day for Vail Mountain. I'll give you a little sneak peek on our terrain offerings. So we have had a very warm fall. We've had just short windows of snowmaking, but our snowmaking can produce when we have the temperatures. So we have, looks like an opening package of Swingsville and Ramshorn above Midvale, if you ski there. And then until we get colder temps, we'll probably be downloading on Gondola 1. So it'll be Gondola 1, Chair 4, a couple of runs, and then download. And then as we get more temps, we'll start to connect the dots and get snow egress down to our villages. So the mountain can transform pretty quickly, and that's our goal. For this winter, some changes from last year. You do not have to make a reservation to ski or ride, so hopefully that's a win. You can come and go as you please, as you did pre-COVID. We will be loading all of our lifts and gondolas to full capacity, so we won't have those long lift lines and ghost lanes in between, and so expect that. And then we are not requiring face coverings outdoors, as was the case last year. We are requiring face coverings indoors this year, so always have that mask handy when you go up on the hill. Your vaccinations are not required to go skiing or to ride our lifts. However, if you go into any of our large cafeteria-style restaurants, for example, Two Elk, we will ask for not only a reservation, but also verification that you've been vaccinated, and then you can come in and enjoy the restaurant as you always have. If you just want to use the restroom or warm up, you can just come in, and you'll be fine. We'll have areas for that. So that's just in a nutshell what to look for. We are excited to get open again in a different version of this pandemic, and look forward to seeing you out on Vail Mountain. And again, thanks to all of you for your support, patience, and the community leadership and collaboration as we go through this marathon of the COVID era.
Thanks, Beth. And for clarification, when Beth says you'll probably be downloading on Gondola 1 right now, she means you will be downloading on Gondola 1 right now. Just a brief point of clarification for you there. Jeff, what do you think? What does normal look like moving forward, and what adaptations might be permanent?
Well, I think, good morning, everybody. I think, from everything I'm seeing, COVID is here for the long haul. That really disappoints me. I was hoping this time, starting up ski season, this was in the rearview mirror, but it doesn't appear to be that way. And so I think, new normal is going to be us managing this. And I think, part of what we're trying to do throughout, not just our own public health team, but our state is how do we manage COVID in this environment, in this world, and with this limited mandates. I mean, it's just going to, those are going to fluctuate back and forth. I think, probably some of the most concerning statistics in Colorado right now is we'll get into this, is how it's maxing out our hospital system. While we're good shape here in Eagle County, which is excellent, our neighbors both to the west and on the Front Range are not. They're in trouble. And so it's that's the big caveat that I think we'll always be sort of managing towards. I thought it'd be helpful just to say, as we try to get back to a normal life, and I think there's some exciting things. I think some of the questions that we have today, we'll talk about housing and transportation and childcare and some environmental resiliency things that the county's working on. And as we dive into those things, we always have to have one foot on COVID. At all times. That part isn't going away. And so some of the goals that we are going to continue to maintain is that we want to keep our kids in school. That's been our number one priority from the day COVID hit the streets in April of 2020. That's a key thing. Support our community's mental health. COVID has been, I have no problem admitting, sitting up here, COVID's been rough on me. It's, I'm tired of it, quite frankly. I don't like masks. I don't like any of this protocol stuff that we have to do, even though I know that it makes sense. But thank goodness for the fact that right before COVID hit, is our partnership with Eagle Valley Behavioral Health really got stood up, and they are rocking it strong right now. And just being on that board, I was so encouraged from our meeting 2 weeks ago of all the things that are coming into the Valley from behavioral health. We want to support our community's impact economically from COVID, and we'll get into that a little bit later. But we're going to continue to support our small businesses, our partnership with Vail Resorts, and everybody that has an association with Vail Resorts, from bike shops, ski shops, everybody. I can't thank this Valley's partnership enough that we can try to work together to keep our businesses open and thriving. And whether it's your favorite restaurant or your favorite watering hole to everything that Vail's going to offer up starting this weekend. Continue to ensure equitable vaccinations to all of our population. Doesn't matter who you are, doesn't matter anything about you. If you want one, you're entitled to get one. And we want to make sure we communicate that out clearly, and we get to the outer reaches of all of our county. And just, we want to reduce the disease spread. I think part of what's tiring me is that COVID is certainly drawn a line in the sand. You're on this side or this side, and I think part of me is really bothered by that, because I look at this audience, and I know many of you, and some of you I don't know, and I know that we all come from different places, but I would love to see the new normal trigger a different amount of civility in how we address COVID. I respect all walks of life, and you've heard me say I can't stand these things, but I wear them when required to and when necessary to, and I certainly don't mind wearing it for on someone else's behalf. And so I think it's I hope that we can begin, as we manage COVID, to step back and look at each other and say, you know what, whether you don't want vaccinated, or you do want vaccinated, or you don't want to wear a mask, or you do wear a mask, I still think we can have that conversation in civility. We seem to be losing that. I can't control the federal world, but I can certainly encourage that in our small county to be mindful of that. Be reasonable with each other, and we share a common theme when the snow starts flying, and let's just remember that. This is a great valley. It's innovative, and I think to Chris's last point of, what does the new norm look like for us? It's going to be innovating and working together as we manage this uncomfortable disease. So thank you.
Thanks, Jeff. And I think your point around civility and empathy and kindness is, let's all do our best to do that in this environment. It's the divisiveness doesn't help anyone move forward, right? So it's okay to be passionate. It's actually really good to be passionate, but in a kind, empathetic way, and an understanding way that life would be no fun if everyone else agreed with you all the time. I know life would be no fun if everyone agreed with me all the time. Will Cook, on the other hand, maybe we want to agree with him some of the time. So Will, what do you think? What does normal look like moving forward, and what adaptations might be here to stay?
Well, first of all, I'm from the South, and I'm Southern Baptist, so the whole civility thing, I can't resist it by saying amen. These are difficult times, and I think we're still in pandemic mode until we get enough herd immunity. And I'm not talking about this valley. I could not be more grateful to Eagle County, the state of Colorado, all of the other providers in this county, most importantly, our frontline providers and staff, and our community that stood up and early on went out and got vaccinated. And it's not a political statement. It's not on the other side of the line in the sand or not. The facts are, and these are from Vail Health and from my former employer, UC Health, 90+% of the people who are in the hospital and 95+% of the people who are in the ICU, which are your two biggest indicators of severity other than mortality, and that's almost 99.9%, are unvaccinated. Getting vaccinated doesn't mean that you won't get it again. There's breakthrough cases. It happens. The vaccination wanes. That's why we get flu shots every year. right? And until the rest of the world does have herd immunity, which comes from either vaccine or getting it yourself, it'll continue to spread in a pandemic kind of way. But ultimately, as we get to that point, it'll turn into an endemic, which basically is a fancy way of saying it's like the flu every year. So what does the New World Order look like? Just like it did with the flu. You're going to go and probably have to get your flu shot. It's going to be mandated if you work in healthcare, and it should. It's probably going to ultimately be mandated in other places too. And it should, just like mumps and polio and all the rest of it. And we got to get over this obsession with arguing about whether or not the vaccine was tested long enough. We have had no deaths in this valley from anything related to a vaccination negative reaction. We have had plenty, unfortunately, deaths from COVID, the overwhelming majority of which is from people who were not vaccinated. So the new normal is get comfortable with getting vaccinated. And if you can't for religious reasons or medical reasons, no problem. But at least let's all work together and accepting it won't be 100%. But let's get it as close to 100% as we can. It's our best way out of this. The other thing you can do, focus on your baseline health. If you look also at people who are the sickest and who are dying the most, it's those who have comorbidities. Comorbidities is another fancy word for saying you may have actually already had diabetes, or you may have had pulmonary disease or cardiovascular disease. And what it really shined a light on is how broken our healthcare system is. And this is why Vail Health has started to focus on things like disparities in healthcare and access to healthcare. Affordability is a huge problem. It's something we're working on now so that it's not a barrier. Managing chronic disease, thinking about our 33-ish% Latinx population and how do we really help them get access to healthcare that they're afraid to use. They help make the engine turn here. They're a huge part of this community. So we got a ton of work to do. And I think our adaptation is how do we address some of those inequities, disparities, affordability, access, managing the population's health. But I will tell you this, having been here now for 3 years this January, I've never seen a community come together in a time of need the way this one does. And so if we can do that going forward and continue to be civil, we got it. Right now, we're full with patients, but they're not from the valley. They're transfers from Alamosa and Montrose and Denver. And they're doing it because there's no more beds available throughout the state of Colorado, and we're all leaning in. But I'll tell you, if the rest of the counties and the rest of the state would do what we've done, I don't think we'd be in this bed crisis. So thank you to all of you who helped make that happen.
Thanks, Will. And Phil Qualman, what do you think in terms of what normal looks like moving forward and what adaptations might be permanent?
Sure, thanks, Chris. We talk a lot about normal, and I think there's a desire to get back to some nostalgic perspective of what normal was, but old normal is insufficient for where we are right now. We've experienced, I think, two of the most disruptive years in the history of our country for our young people in K-12 public education. We have never seen this level of dramatic change in their experience. So what is normal for us moving forward will be some of the characteristics that we have had to embody in the last 2 years, which are awareness and responsiveness. So we have to watch our kids, we have to watch our staff, we have to see what are the needs that they're bringing to school that are different from what we've experienced in the past. And then we need to be responsive to those needs. And they're different needs than we've ever seen before. So as much as we would love to get back to that nostalgic focus on reading, writing, math, academics, we've got some dysregulated kids and adults in our system. And if we're not aware of those needs and adapting our systems to focus on those needs, it's going to be an uphill climb. So it was mentioned earlier that Eagle Valley Behavioral Health was initiated before the pandemic struck, which I think was incredibly fortunate for this community. We rely heavily on that relationship with EVBH, with the Hope Center, to provide additional services for social and emotional health in our schools. And that's going to be our continued normal. We're going to need to continue to leverage those relationships and make sure that people's hearts are well, both students and staff, so that they're in the right emotional place to learn. Because if they come in experiencing a lot of different kind of trauma and their hearts aren't regulated, you're really wasting a lot of time trying to teach them when they can't focus. New normal means that we're continuing to focus on hearts because we know that that's how we eventually get to minds.
Excellent. Thanks, Phil. And this entire discussion is not going to be focused around COVID. You guys might have questions related to follow up on that, and I would encourage you to ask those when we get to the audience Q&A part. But it's all kind of reflective of COVID, right? Because COVID sets the stage. That's why we started with that question. And Phil, we're going to start with you on this one. One of the things we're seeing across the country, not only in resort communities, is staffing shortages. This is everywhere. Cities, suburbs, rural areas, resort communities. It's not unique to us. So what are you doing to attract workers, and how do you feel about your staffing levels right now?
We started the school year very optimistic about our staffing level. Through our negotiations process with our Teachers Association, we've committed more funds to staffing than we have had since the recession. So we were really looking forward to having small class sizes and incredible support for our students coming into this tough year. And then there's a staffing shortage. So we've got all this budget committed towards staff, and at our worst point, we had 9% of our overall positions vacant. We're down to 7% now, so we're making progress. So to make working for our district more competitive, we've done some mid-year salary adjustments. We've done some mid-year hiring bonuses. We just finished the negotiations last night with our Teachers Association and are looking at mid-year salary adjustments for everybody in the organization. I think the other big piece that we're focused on is affordable housing. And I know that's on the agenda later, so I can speak to that in more detail. But we put a lot of energy, a lot of resources, a lot of creative thinking into solutions around affordable housing. And another thing that's on the agenda later are the J1 visas, and we're also exploring that to some fruition. So we'll cover those later.
A focus for everyone across industry sector for sure. Will, again, I think that healthcare is not immune to the staffing shortages and the challenge with attracting and retaining workers. So how do you feel about your staffing levels, and what are you guys doing at Vail Health?
So prior to the pandemic, we had more people retiring from healthcare than were joining the ranks. And that supply and demand imbalance has gotten worse since the pandemic because, like many other industries, employees are gassed. And many of them had some time off, not frontline nurses. You can't work remotely when you're taking care of a patient, but there's other support staff positions that when they had a time to work at home and have a better work-life balance, started to really question what do they want their new normal to look like in terms of the grind. And so, when you think about this crisis that's going on now in the state of Colorado with lack of available beds, their number of ICU beds this time last year, staffed available beds, was 1,900. Now it's 1,600. And that's a big percentage reduction, and it's entirely related to staffing. And we feel it with Eagle County paramedics. We feel it in Colorado Mountain Medical. We feel it in every area. We've got a 40% vacancy rate in clinical assistants. These are the folks that assist in a doctor's office. They also assist in a nursing unit. And so it is widespread and problematic. Today we have about 20 patients admitted in-house, and we have about 56 beds. Not that we would staff all of those, but the point is our most critical pathway, our biggest rate limiting factor is staff. And so we're trying to work with CMC to create ladders to let people grow. We're trying to figure out ways that we bring in staff from all over the country, travelers, which unfortunately cost 2 and 3x of what a normal staff member costs. We're trying to address the housing issue as well, including our board just recently approved through our strategic plan between $10 and $20 million for us to go and try and find land to build multi-unit housing so we're not just renting it from other places. We, of course, will have to work with the county and local municipalities and going through those processes, but housing, daycare, growth, flexible schedules, these are all the things that we're seeing are imperative for us. And in our world, it's really also about taking good care of them. So we created the Mountain Strong Employee Assistance Program to give them free access to behavioral health, Eagle Valley Behavioral Health is a wholly owned subsidiary of Vail Health, but it is a county organization and resource. And we're trying to leverage those to help people get through these difficult times of day in and day out taking care of people who are dying, but listening to rhetoric that it's a fake virus and that people shouldn't get vaccinated. And our frontline workers oftentimes get ridiculed for that, and it's very difficult for them psychologically. So trying to protect their mental health is a really important priority of ours as well.
Well, thank you to your team and everything that both the school system and teachers and the healthcare workers at the front line, and appreciate you sharing your thoughts on the staffing issue. Jeff, you guys are a large employer as well, and probably not immune to this staffing shortage. So what's Eagle County doing to attract workers, and how do you feel about staffing levels?
You know, I think out of all my colleagues up here, we're probably in the best shape in terms of staffing levels. We've got 520-ish employees in Eagle County, and we probably have 30 openings. But and where we see the biggest need is bus drivers and seasonal workers at the airport, those kinds of things. So, but for the most part, I think we're doing well. The sheriff's office is really well staffed, and they've got a good program. And we've had to dig into the well a little bit and be creative. And the commissioners have been very supportive of some of the incentives. And we've done some mid-year salary adjustments, and we've got a salary study. So I think overall, from that perspective, from Eagle County, we're doing okay. However, we really feel as one of the regulatory agencies in the Valley and just one of the partners that we're very, very sensitive to the success of not only the three organizations that are represented with me up here, but the entire business community. That housing is our number one strategic initiative and strategic priority right now because of these various things that you heard, and I'm sure Beth will share more from our largest employer in the Valley. So we're going to continue working on that. I think every study that every survey that we've done since I've been with the county is very loud and clear: housing, and that directly relates to our staffing shortages. So we'll keep pressing that issue.
Yeah, and Eagle County has played a pretty big leadership role with the housing big goals, and I'm not getting the term exactly right. What's the exact word you guys are using? The big goals. They invested a lot of money and a lot of efforts there. So bold moves. So kudos. Thank you, Joanne, and kudos for that. And let's hope that trend continues. Beth, how about you from a Vail Mountain, Vail Resort standpoint? What are you doing to attract workers, and how do you feel about staffing levels right now?
Yeah, our single biggest move this year as a company was taking our minimum wage from $12.50 an hour to $15. So that was a significant investment back into being able to attract talent and retain them. We've also improved our benefits packages from part-time, full-time across the board. Our housing, of course, we never have enough. We'll talk about that later. But when we have housing, we can fill those hard-to-fill positions quicker and retain them for the season. We look at when we are not only recruiting our employees, but also saying, okay, how are we going to retain them? And that's all culture. So when they come to our mountain, we want them to have fun. They're here to have fun. And we want them to be able to sustain a season here with being able to afford groceries and have a bed and nice uniform and clothes and friends and fun. So we have a whole employee experience group teed up in every resort. So we're just focused on what can we do for fun? What's meaningful for our employees? And it's pretty exciting. We do it each year. We also, from a staffing perspective, we're pacing about where we are historically at this time of year with applicant flow. The real proof of the pudding is between now and Christmas and how we fill in, because it's as we ramp up the season, we don't need a full roster right now, but we will when we go into the holiday season. So we still have some time, and we'll see how that fills in. But in the meantime, we've cross-trained every department to be able to do multiple jobs. So when we have pockets where we need to jump in, we all can, and that's all of us, me included, so we can keep everything running and providing that guest experience for everyone. So that's where we are today, and hopefully we'll fill in and we'll be able to offer a great experience for everyone.
Yeah, and Beth, we'll keep this one with you because it's related, and you touched on it a little bit around workforce retention. So rather than the attraction and the staffing levels, retention. What are one or two tips that you would want to share with the audience around workforce retention? You talked about fun and having that culture. Is there anything else you'd want to share? And that can be, for each of you guys as we go through this question, that could be retention of employees. That could be retention of people in the community. We've seen a large outflux over the past 20 months of workforce, people in their prime working years. That could be retention of businesses. Whatever frame that you look at this lens of retention, what are 1 or 2 tips you would share around retention?
I would say the biggest tip is everyone deserves to work for a great boss. So our company puts in a huge amount of effort into leadership development, so we can really inspire and be supportive and lead our teams, because we see when turnover occurs, they're quitting their boss, not necessarily their job always. Sometimes it is, and sometimes it's both. So we want to set a culture where they feel good about coming to work, supported, led, and they can have a sustainable season, which are all these other pieces of housing and affordable groceries and all those things that come in just a baseline, live here for a season.
Yeah, thanks. And my whole team is going to come talk to you about jobs now, because retention is about having a great boss. So thanks for stealing all my employees this morning, Beth.
There's the quote.
I really appreciate you. We're not going to have any more questions for you. Jeff Schroll, what do you think? 1 or 2 tips you'd like to share related to retention of employees, of businesses, maybe from an Eagle County standpoint, of community members?
Well, first, if you work for the VVP, my email address is jeff.schroll@eaglecounty.us. I'd like to talk to you. I don't know if I can speak about myself being a good boss, but I have a great team of, I think Beth is right, we have a great team of directors. I've got a great team of chief officers that work with me in my department, and of course the relationship that we have with the Board of County Commissioners. This may sound mundane, but I think whether you're in a pandemic that's got shortage of housing and shortage of employees, you can't stop trying to have fun at your job and the place that you work. And so I say that as my computer here is had my staff update my notes for me, so that's why I pulled my computer up. But it's blowing up with some of my staff talking trash about fantasy football with each other. So those are just some things that we want to be competitive in the marketplace. We want to from whether it's salaries, but it's also we want to be a place that can come to work. And we've really tried to balance. While COVID is a Debbie Downer, there are some things that's come out of it. Okay, that we have a lot of places and a lot of our departments that can work from home, work remote. That's been a different kind of a benefit for those who need childcare. And when we all went into lockdown, as fun as that wasn't, you were home with your kids and you got to spend that time with them, and then some folks have been able to transition. That's not if you're working for Eagle County Road and Bridge, you can't plow streets from home. You've got to be out in the field, and we've got several places like that too. So we try to work that balance and encourage our directors and our staff to be innovative and be creative about finding new things and solutions. And the topic of the day will always come back to housing. That's we've got to do a better job providing housing for everybody. I think that's we can recruit, but if we can't find places for them to live, that kind of stops us right there.
Yeah, thanks, Jeff. Will, thoughts on 1 or 2 tips you'd like to share with regards to retention?
Internally, it's what everybody's talking about. It's culture and making sure that you're taking care of your people holistically, not just thinking about their job, but what are they having to face outside of the job. And that gets into things like housing, which we have not done a good enough job with, and daycare. And really, part of what we're looking at now is how do we structure and tier our benefits based on how much you make, right? So for someone who makes less than, say, $50,000, how do they pay nothing for health insurance? How do they pay nothing for housing subsidies? How do they pay nothing for as much as possible so that smaller compensation on a total disposable income perspective is enough to make ends meet, right? And so that's internally facing. Externally facing, we're trying to remove the barriers that are preventing businesses from retaining folks themselves, which gets into things like addressing the cost of healthcare and how do we bring that down so it's not like housing and not like childcare. There's a lot of stuff that's going to be coming out relative to that for benefit year 23 that, thanks to Chris, we're working with him and his team on. But that's one of them. The other is we're feeling we're treating the symptoms right now by building up behavioral health and adding 50 providers and working with the Hope Center on co-crisis response and all these great things that Eagle Valley Behavioral Health is doing. But what we really need to do is shift from putting out the fires to fire mitigation, which gets more into getting upstream to problems and getting people comfortable with talking about it and putting it in the schools and putting it in primary care. And, we got to shift the paradigm from reaction to prevention. And so that's really a big area of focus for us, because a lot of folks are leaving because they just can't make it work anymore. And we got to remove the healthcare pieces of that.
Yeah, thanks, Will, and thanks for prefacing that without trying to steal my employees. Like I offered to Beth, and like Jeff tried to do. So thanks for that. I know he already did. That's okay. That was supposed to be an inside joke. Phil, how about you around retention? You guys are a very large employer, the second largest employer in the county, providing a really essential service. What are you guys doing in terms of retention?
Chris, you talk a good game, but you've got one of my former teachers on your staff here, just FYI.
You're not supposed to say that either.
Some practical things that we're doing, we've already talked about, trying to make housing more affordable, trying to adjust compensation to be more competitive. But then I think there's some philosophical changes that we're trying to implement. We're trying to empower our employees with voice. When I took the position, we only had like a quarterly meeting with our association reps to hear about their concerns, and we now invite them to meet once a month. Plus, we've invited them to several of the district level meetings so that we do have teacher and employee voice in our budget committees and our district accountability committees and our ad team meetings. So really trying to empower them, tell them that their opinion matters, that we need to hear from our frontline people what the experience is like, so that we can reflect on that and make the appropriate changes. Extending on what Will said, our employee assistance program is a lot more robust than it used to be. So that's another level of support that we can offer them in these challenging times. And the last piece I would say is going back to the previous question about what new normal looks like. And we've had to not just give our staff permission to have fun in the job, but really tell them you have to find time to have fun. So we've been so focused on the academics for years and the accountability pieces associated with that. But when people are, as I used the term earlier, dysregulated, sometimes you need to have those times built in, especially this year when you say, if you need to have an ice cream party in January, then have it. If you need to take your staff out to FAC on Friday and Tuesday, then do that. Like, find these times where you can celebrate, where you can have fun, so that we're not all go and just amping up the anxiety, but we slow down and we find time to remember that it's about relationships and good times.
Yeah, I think the idea of celebrating success is an important thing across not just your organizations, but the entire community within your sphere of influence. Celebrate the successes. It's easy to go into that quagmire of all the challenges and headwinds, and we'll talk about some of those things next. But celebrating the successes, I think, is a great message, Phil. So thank you. Quick question, probably for Beth, but would look to any of you to jump in on. Our community for years and years, certainly the 25 years I've been here, and probably prior to that, have relied on visa workers because there's just not enough employees to meet our labor needs. So what is the status of J1 and H-2B visa programs, Beth?
Yes, I mean, we took last season off without any international workforce, and we're bringing them back full force again this year. They typically arrive right before Christmas, so we will lean on them heavily this year to execute everything on the mountain. And primarily we use our international workforce in our hospitality F&B operations, so they're going to be a huge boost to us this year. But yes, we're fully executing on that.
Yeah, it was hard for a lot of industries, hospitality, landscaping, many others, not to have that H-2B. And that we can do a whole session with a symposium on all the broken parts of the immigration system, because it's completely broken. But it's good that those are starting to come back. Anyone want to add anything on the visa program? Phil?
Yeah, we rely heavily on J1 visas. We have the majority of our schools are dual language, so we do a lot of recruiting in Spain. This year we've had tremendous success in the Philippines, which was a Spanish colony until 1898. So many of them are bilingual as well. But we find that process mired in bureaucracy and incredibly slow. It also puts an additional burden on our housing needs because we often need to have something that's fully furnished, turnkey, and ready for folks when they arrive. So it's helpful, but it comes at additional costs for sure.
Yeah, good. Thank you both for addressing that. It's a big deal. Let's talk about some of those headwinds. And Will, maybe we'll start with you and work our way down. Housing, early childhood, mental health, transportation, health insurance, cost of living. We've touched on each of these. We're making progress on a lot of these topics, right? Private sector, public sector, nonprofit sector. My question for you guys with regards to this is, how do you balance your business operations, running your organizations, with being part of the solution to these big picture community issues?
You know, because we're 1,400 plus employees, plus their loved ones, and one of the larger employers here in the Valley, you really have to address both, right? And so one of the things that we've been really concerned about, I'll just stay off of housing now because you heard me say something about it before, and I'm sure there's more questions coming in a little bit. But childcare, daycare is equally as concerning. And, you know, you've got a lot of these, you know, smaller mom and pop like businesses who are trying to retain and recruit staff at a wage that may no longer be competitive, and they're trying to think about benefits, one of which is healthcare, which is, again, why we've got to make it more affordable. But there's enough room space in most instances. There's just not enough staff. It's just like hospital beds. And so, you know, how do we work with the county who's been helping lead this initiative to figure out what are we going to do to co-op our resources? Because if Vail Health goes out and solves this on our own, and we, as an example, try to stand something up or take one that's struggling and infuse more resources to it, any gain we get in terms of number of spots is going to come at the loss of somebody else. And, you know, that's a real challenge we have. How do we strike that balance between solving our own problems? And remember, a big part of our labor force are nurses, some of whom are women who are having kids, and even men too, and they too have to, you know, figure out how they grapple with this. So I would say childcare, daycare, and figuring out a way that we can pool resources to fix this is a huge deal. I would put it up there almost as much as housing.
Yeah, we hear that a lot. It shows up in a lot of our surveys. Jeff, how about you guys at Eagle County? How do you balance your business operation and the need to be part of the big picture, solving these big picture community issues?
You know, the talent at Eagle County is pretty phenomenal. So we obviously have a lot of day-to-day business and that we work all the way from our motor vehicles to the law enforcement to, you know, making sure your roads are safe and the airport runs on time and the buses. And so I feel really comfortable that we're good at our day-to-day operations. I think the other issues are really what the commissioners have just you know, I think we'll go a lot more public with it here over the next coming weeks, is their new strategic initiatives, and they are centered around housing, early child care, environmental and transportation. And one of the things I think is important for, you know, folks here and those watching, again, another positive thing that I think came out of COVID is early on in that, when we started that, I kind of got, you know, the band back together, so to speak, where the town managers, all the town managers in the Valley, including Basalt, and I even invite Chris sometimes, but actually every week, but we get together every other Wednesday, and we've been pretty faithful about that, even as COVID has kind of slowed down and waned. And before it was just really kind of COVID-related responses, but now you know, a lot of you know I was with you know, Gypsum for a good many years, and you know, when I started my career here in the Valley 30 years ago, we were all pretty isolated and pretty siloed. You know, Gypsum did its thing, Eagle did its thing, Vail did its thing. man, we are so connected now, and it's really nice to be able to have conversations. And I really think, I would encourage you to kind of wait with bated anticipation on some of the things you're going to see from collaborations of, with Vail Health, with the school district, with Vail Resorts, and with their municipal partners as well in the areas of housing, early childcare, those two things in particular. You're going to see a lot more collaboration come out, as I think it's already out that we're working on an RTA to have a much more reliable, robust, and beefed up transportation system in our valley. So that partnership, I think, as we've kind of taken down the walls of our city and county boundaries and started to look at, where do we want to put that housing that's going to benefit, the four of us up here, but also, the small mom and pop businesses, and, where is it close to, transportation line, where is it close to medical services and schools and those kinds of things. So I think that's some good news, and that's, those are things that the commissioners are absolutely committed to with their new plan.
That leadership and collaboration across the municipal partners, the private sector, the nonprofit sector, is at a level that it's never been before. So kudos to you and the BOCC and others who have helped lead that, because it does make a difference, and it will help move the needle on some of these things, even if they're all long tail game types of things. These aren't transactional, wave the magic wand issues. Beth, how about you? How does Vail Resorts balance your business operations and the need to be part of the solution to big picture issues?
Well, I'll start with just building on what Jeff said. I think one of the big silver linings of the COVID era is the collaboration between every aspect of our community, whether it was Vail Health or me being able to call the commissioners and just get some early guidance on what's happening around us and swirling as we went into the early stages of everything. But I think coming out of that, we've never been stronger. To Jeff's point, I think we have these relationships and phone calls and text away and a coffee away to just sit down and say, what can we do together to collaborate and solve? Because I don't think any one entity can solve any of these issues that we're talking about. So all of us, the community leaders, just need to work together and just keep it the highest priority on these things, whether it's housing or childcare or affordability to live in this valley. We've got to work together.
Yep. And Phil?
I think the first piece to balance is having a comprehensive strategic plan. You've got to recognize all those different challenges, have them identified in your plan, and then have some strategies for how you're going to address them. And then to expand on what others have said, we have to recognize that we can't do it by ourselves. And we really rely on our community partners. And we have partnerships with everybody up here, with Eagle County, with Vail Health, Vail Resorts. But we also rely heavily on our nonprofits, and I see leaders of our nonprofits in the audience here. I see Seth, I see Sarah, I see Markian. So we rely heavily on these relationships to supplement what we do for our students through community activities. So understanding that we are a community and we're in this together helps us manage the workload.
Yeah, and Phil, let's keep it with you on this next one. So let's get really specific around housing. We've talked, it's the number one issue. I know that Jeff talked about the commissioners making that a priority. We've touched on it, but specifically, what efforts has your organization pursued to alleviate the housing stress on your workforce?
How much time do I have?
You keep it short. You've got some good stuff going on, but keep it short.
Sure. When I took the position 3 years ago, we had 12 rental units that we managed, 12, and over 1,000 employees. So I recognized immediately that was woefully behind the need. So we created a housing master plan. That was our first effort. That was pre-COVID. So shortly after we developed a 10-year housing master plan, we hit COVID, which we'll call a rough patch. Understatement? So it put the brakes on the plan a little bit, but coming out and through COVID, we've managed to address some of that plan through master leases. So we've master leased about 20 units up and down the valley that we manage and can control for our employees, which has been great for our folks on J1 visas. But I think our bigger projects are related to building affordable housing units that are for sale, and we've done that through our partnership with Habitat for Humanity. We're very fortunate as an educational entity that when developers have big projects, they have to provide the school district with a small parcel of land to address housing needs. So we have small parcels of land throughout the county. And by partnering with Habitat for Humanity, we've been able to build homes for sale at the 80 to 100% AMI, which is right in the ballpark for many of our employees. And I think the last big project or piece of our plan that we're making progress on right now is a rental development just to the east of here on the other side of Battle Mountain High School. We've got a board approval on that. We're getting financing approved this week, and it'll be 37 rental units. And I think the big piece of that is that we've tried to own and define affordability outside of AMI. AMI is an abstract number and it's not super relevant to our community. But what we do know is what our base salary is. So we've defined affordability off of base salary, and then what is 30% of gross or 40% of net. That's the percentage of your income that you should be able to put towards housing, and that's what any mortgage company would call affordable. So how can we build and provide a rental unit that meets that definition of affordability? So we got creative on the financing with this development coming down the street here, and we're going to do it with certificates of participation, which we're afforded to do as a public entity. So we don't have to ask the community to bond this. We can do this through a COP, certificate of participation, and the rental income generated from the facilities that we're designing will pay for the COPs at rates that are well below what the community the rates are right now. So really three things: master leases, partnership with Habitat, and redefining how we finance and how we define affordability.
I'm really glad you shared the Battle Mountain. I'm going to call it the Battle Mountain Project, for lack of a better term, right here in Edwards, because it's incredibly innovative. I don't know of anyone else around the country addressing housing in this way, and it's completely scalable across some of the other plots of land you talked about. So huge round of applause and kudos to Phil and the school district board for having the courage and the insight to take this step. It's a really big deal. So thank you for that, and let's hope that scales across other plots of land too. It'll make a big impact. Will, how about you at Vail Health? What efforts have you done to alleviate housing stress on your workforce?
Sorry, I forgot about my mask, and also for looking at my phone. I keep all my notes there, so I don't want you to think I'm up here texting with Jeff about how my fantasy football team is better than his. A few things. Mass releases are important, and there's been several developments where we have mass released a big chunk of the availability to enable us to provide it to especially those lower paid employees. We also are looking at what is affordability, and we're not only doing it with healthcare, which is approximately 8.5% of AMI, and again, AMI is hard to define in this valley and in other places. But if you think about, where someone spends their paycheck, clearly housing is the biggest chunk of your disposable income. And so how do we, again, as I mentioned earlier, try to have a sliding fee schedule of sorts that says, based on how much you make, this is how much of a subsidy we're able to provide. And what's that gap between what that amount of money is that we think is affordable for housing and what they're actually making when everything else is taken out of it? So there's some math in there that has to be done, and then you have to basically tailor your benefits to that. I think a third thing is, and I alluded to it earlier, we can't and we shouldn't just lease up all the inventory that's out there, because per some of the questions that Merv asked that he handed to me before, it leaves less left over for the places who can't afford it the way that, say, a Vail Health can, right? So we're looking actually literally, and I can't say too much out loud right now because I haven't gone through the process of talking with Eagle County and even with a partner that owns part of the land with us, but we literally are looking at, several acres to try and build out housing that would not be something we're leasing our own, that yes would be entirely probably for our employees, but at least it then removes them out of the inventory they're taking in other places, right? And I'm talking, this would be millions of dollars in investments. And I'll say just one last thing, because so many of you in this audience have been incredibly supportive of our PUD process for a new behavioral health facility in North Star here in Edwards, which is again a community need that we're trying to address, but there are some who are opposed to it. And as a person who didn't live in the mountains that long, I watch these often conflicting forces of we need more housing, it's got to be higher density, and then someone puts forward with a plan and it gets killed in a PUD process. So we got to find that balance between protecting this beautiful place in which we live and also recognizing if you're going to address housing, somebody's not going to be happy about it. And so when it comes time to show up at a hearing or voice your support for something, I encourage you to think about that balance. How do we keep this place beautiful? But we also, if we need more inventory, we're going to have to build.
Yep. Thanks, Will. Jeff, I'll give you an option. We talked about the Eagle County housing bold moves. Do you have anything to add to the housing discussion? We know it's the #1 priority, and we've got strategic initiatives coming from the BOCC soon. Anything else?
The bold moves really was an initiative that the commissioners, I think it was 3 months ago, looking at Commissioner Scher, Commissioner Chandler Henry 3 months ago-ish, where they, somewhat surprising to us, just Kimball Williams, who's in the back, that, do you have the cue cards to show me exactly what those things are for the, yeah, thank you. Because I won't remember all the details of our housing bold moves, but they allocated $10 million out of our reserves directly to the housing program to do meaningful things. And so I won't be able to rattle those off, but down payment assistance and purchasing and all kinds of different things along those lines. But again, it also comes back to our partnership. If I think we're about ready to see a several $1 million injection and another one into our housing program from a sale. So that's real money that if it turns out that we can partner with Vail Health, I know Vail and Avon, both of those towns want to partner with us as well. I think to Will's point, we've got to be able to find some places where we can go vertical, and we're trying to be very mindful. We want those places to be close to services. We want those places to be close to mass transportation and be as walkable as It doesn't make sense to take a new subdivision and stick it way up 131 or those kinds of things, or top of Cottonwood Pass. But so we're trying to be very mindful of that and working with our partners to build something meaningful and that can truly take a bite out of what our housing needs are.
Good. Thanks, Jeff. And Beth, the last one for this question with housing. What efforts have you pursued to alleviate the housing stress on your workforce?
I think it's very similar to what everyone's speaking to. We really have 3 buckets we look at. We do have our owned and operated and managed properties for housing, which we've had for many, many years, and I think that's one bucket. The second is we look at master leasing for long term, if possible, and commit to that. That's our second bucket, and the third is new build, because we are to that point where we need to look at really, really solving this, and that's going to take some new builds. And again, it's not I can't solve it, Jeff can't solve it, Will can't solve it, Phil can't. It's going to take all of us to do it, and we can do it. We just need to keep it as our highest priority because it just keeps coming back every year as the #1 priority, and we haven't solved it yet. So I'm motivated.
Yeah, the idea of housing is a yes and, right? Yes, we need deed restrictions, and we need partnerships, and we need new build, and we need yes and to really do this. I don't think we can never build our way out of this problem, and nor should we, right? We need to do all of these things. So thank you all for answering that one. We have about 30 minutes left, and that's what we had allocated for audience Q&A. So what I'm going to ask is throw your hand up. I will do my best to rephrase your question for the group, and we'll go from there. So first one is Merv, and then we'll do Joanne, and then Mark Ian, and then I'm going to forget. So after Merv, keep your hands up, okay? Merv, first question. I'll repeat the question. All right, so I'm going to do my best to consolidate that, and I'll look to the group here. But the idea of an employer versus an employee housing shortage, and what you're doing to address the employer section. I think you guys alluded to that, or actually directly talked about that on the last one, but I want to give you the opportunity to do that. And then if you have any information you might be able to share around seasonal housing units, we'll take that first, and then we'll look at the other ones. And I'll open it up to any of you guys that might have something to share on that.
Yeah. Hey, thanks, Murph. Those are great questions. I think I don't have specifics on all the beds and everything that you're asking on, but I do know that our seasonal housing that we have, we own, operate, master lease, it is filled with our hard-to-fill full-time seasonal workforce. So when we look at who's in those beds over the winter months, that's who's filling our beds. So because we have an influx of several hundred employees in the winter to execute on the mountain, and then there's seasonal roles and they go away, and we have more housing for summer. So that's really the only piece of data I could speak to on those questions, but wanted to at least address that.
Anyone else want to jump in on that one? Jeff, and then Phil.
I keep looking to Kim, flash me numbers, how many beds we have. Just kidding. But I don't know how many we have. I can tell you that pretty much whatever beds that we do have that Eagle County owns as an employer are I'm going to be pretty 100% guess that they're for all of our employees that make less than $75,000 a year. So I think that's important. And we're continuing. I think part of our build better or bold moves. Sorry, that build better's the president's. Ours is bold moves. Sorry, we're that's really was designed to help us out as an employer, and then our partnerships are what we're trying to do to help everybody else see some additional employee housing. To the questions you asked, Merv, about should municipalities, and I think it goes to what Chris said. It's yes and. It has to be the right locations. It has to be in the right places and make the most sense. We want them to be walkable. We want them to be on transit lines. We want them to be close to services for a variety of reasons, including environmental, but also just ease of services. So I think it is a yes and. I don't know that it's a yes always, but it's certainly a yes and those are the conversations that we're beginning to have with our municipal partners.
Phil?
Merv, I totally agree with you in terms of the employer versus employee. I think it's our challenge to solve. I think we have the resources to do so and the leverage to do so, and to expect employees to solve this is unrealistic. In terms of real numbers, 3 years ago we managed 12 rentals that we own. Now we have over 30. And in a year and a half, when this Edwards project is done, we'll have over 70. So this is exponential growth, and it's part of our 10-year plan. I hope we can continue with that trajectory to address the needs of our staff as we've determined through our housing master plan. And when we built that plan 3 years ago, it was about 15% of our staff said that they are in need of something new or different than what they're currently in. I suspect that that's higher now, probably 20%. So we're approaching that demand, but we still have room to go.
And Will, you talked a little bit about a project in your strategic plan. Anything else to add to that?
The short answer is not enough. And now that it is such a strategic focus for us, I should be able to spout the numbers out as easily as I can spout how many beds we have versus how many are staffed. So we have work to do there, Merv, and we'll be happy to provide those numbers to you offline outside of this. Ours has also seen exponential growth in terms of the amount that we have, and it's focused on the lower paid employees, everything I said before, but it still isn't enough. And I think that as we have a plan in place, we have to have metrics to track it, and this is a great one, so I appreciate the question.
Yeah, and the other part, and this one for Beth, was the 14th place in the Ski Magazine poll. And why do you think we have fallen so far? Any thoughts on that?
I would say, we have all kinds of magazine polls and rankings that we look at holistically, but I would say I don't typically over-index on a rating in a magazine, but I do pay attention to the feedback we're getting in real time from our guests on the mountain, whether it's coming up to me in person, emails, and we have every day sending out, maybe you've gotten them if you skied our mountain, our guest experience surveys. So we're getting in real time. That's what we're focused on, and if we can make change for the next day to make that next day better, we will. Some things we can't, but we're looking holistically at ratings, feedback, real time, and doing the best we can. But we're absolutely committed to delivering a world-class experience to our guests on any given day. Please know that.
Yeah, and I would add to that one from my lens and my perspective. That's not a Vail Resorts problem as much as it is all of our problems, and it's the towns, it's the business community. We are all responsible for the guest experience, and moving on any rating talks to the guest experience. So every restaurant, every ski shop, every retailer, transportation company, lodging property, nonprofit, person on a bus who interacts with a guest has shared responsibility for the guest experience, and that I think reflects in some of these things. So my own 2 cents, even though I'm not on the panel. Joanne, you had a question, and then we'll get Mark in, and then I'll look for other hands. All right, so I'm going to do my best. I might come back to you because you unloaded 4 questions for 4 panelists, and I can't remember more than 2 things at one time. Beth, incentives for day travelers to ski midweek versus weekend.
Thanks. Great question. I hadn't really thought specifically about that. The one thing that has evolved over time with our pass product, with our guests moving and shifting into that rather than a day ticket, is we can capture a tremendous amount of data around guest behavior. So we have a database that's incredibly robust and allows us to try to project behavior. What we did see last year, what was really interesting, is that with people working from home, kids that maybe work in hybrid, some at home and some in the classroom, we saw midweek visitation that we hadn't seen before. So we were always busy. We'd have our pop on the weekends, but it was nice to see the Monday through Thursday really start to be more utilized by our guests, front range, locals, everyone. And so we did see that evening. And when you're in operations, I'd rather be busy all the time than slow a few days and then we pop. So we started to see that last year, and it was more, I think, of a outcome of COVID and people's flexibility in their schedules. But we did see behavioral shifts, and we'll see if that continues as people have kind of new work scenarios. But yeah, we have a significant database now with our pass holders, so we're going to do everything we can with that information to help move our guests around and utilize every day of the week, not just the weekends.
Jeff, homestead exemptions related to the housing issue and helping people age in place.
Joanne, that's a great question to nail me with in front of 2 of my bosses. And instead of trying to blunder it, let me just say I don't know. Because from that perspective, I don't know that we've talked about it. I know that it needs some legislative work. And I think our commissioners are going to be committed to watching that in particular, because that's come up before. I can tell you this, in the whole world of housing, it was just Monday at a work session with the commissioners and my team that we were, as part of the housing, whether it's, for employees and things like that, it's important for us to be able to keep all of our population, and that includes our older population as well. To have a healthy community, it needs young people all the way to our older population, and it doesn't help us to not have a a program or opportunities that are in place that once you hit a certain age or you've got certain health issues, you're just automatically moving to Grand Junction, or you're going to lower altitude or wherever you're at. If we can keep folks in place and have them age in place, we want to do that. I mean, that's important. That's an important part of our roles and responsibilities. And part of the other conversation that came up is that for me my wife will probably never let me retire. She'll always go make me do something, just to stay out of her hair a little bit. But we think people can address some of the housing or the employment shortages if we can keep people aged in place and let them work as long as they want to. Not necessarily have to watch our population dwindle out of the valley because they have to. We would like to take a more active role in that.
And Will, when should she get her booster shot?
Yesterday.
Yesterday.
And now, especially if you're traveling December 17th, you can get it anywhere, folks. You can get it at any of your retail pharmacies. You can come to us. You can go to Eagle County. You can look on all of our websites. If you had Moderna, I encourage you to get Pfizer. If you had Pfizer, I encourage you to get Moderna. It's totally appropriate to mix match. If you'd rather stick with the one you had before, that's fine too. Please, I encourage you to get it. And if you got youngsters between 5 and 11, I'm sorry? No. Nope. Nope. Go. Just go.
And
okay?
the question there for those on TV or who didn't hear is, do you have to wait the 6 months? And Will says, an enthusiastic no.
No.
You can go get the booster immediately.
Go get it.
Okay. And Phil, I knew I wouldn't remember all 4 questions.
I got it.
Perfect.
Yeah. So do we honor the desires of those who don't want masks or vaccines for their kids with segregated facilities? I would say we honor that through our expansion of our online programming through World Academy, but we don't have segregated facilities, I think, first of all, because it doesn't really meet the intent of the public health orders, and secondly, because I couldn't in good conscience ask our staff to serve in those environments and have really fair and equal conditions for everybody in the organization.
So we had a question come in on text, and then we'll get to Markian and others. The question from a viewer is, and it's specific to Will. What exactly are you doing to make healthcare more affordable?
Great question. Oh, sorry. So a variety of things. Last year, actually about 18 months ago, we gave almost double-digit decreases in our reimbursement rates to Anthem to enable them to pass that entirely along to a lower cost option on the individual and small group. That was right when Kaiser was leaving the market. Number 2, we were waiting to see what happened with the public option, which is now called the standard benefit design, which got voted in late May of last year. Since that time, we've been working with the Vail Valley Partnership. We've in the process now of negotiating with another commercial insurance carrier on creating a lower cost option that will be on the market for benefit year 23. And you say to yourself, why not this January? Well, in order to do it, you have to have everything filed with the insurance commissioner by June. It's got to get approved and then prepared for open enrollment. So there's a lot of stuff coming there. We've lowered rates on our shoppable services. We've provided a ton of free care to people who can't afford it, whether or not that's COVID or not, getting into the neighborhoods that need it, et cetera, but it's not enough. Like housing, like childcare, it's not enough. But I tell you, come benefit year 23, and you'll start seeing about it about a year from now in the open enrollment in 22, you will see significantly more affordable options for health insurance in this valley.
Yep, and that's through a healthcare purchasing collaborative that we're building. And I wish these things were easy, but there's a lot of bureaucracy from our friends at the state and at a federal level, and we're working through all of those things, but it will be meaningful, to Will's point. So, Markian, you had a question, and then I'll look for other hands over here. Yeah, we'll start with Phil and the question around climate change and what you're doing locally and within your organization with that recognition that climate change is real and is impactful, and we have operational things we can do to benefit that and help that.
Yeah, I think two things, Mark, that I could speak to. One is our partnership with Walking Mountains. We try to send as many of our kids to the Walking Mountains program as we can to make sure they understand the value of stewardship of our resources. So they're learning how to do it better than we have done it. I think practically for our organization, we've converted all of our lighting over to LED, save one school, and that project is starting soon. So that's been a big energy saver for us. We're also in the process of putting together an RFP for a solar project. We've got a lot of flat roofs in our organization, and we own some parcels of land that aren't developed, and we think that there's potential there for some clean energy that could also offset the energy that we use as an organization. So look for that soon.
Anyone else want to share on this, what you're doing, Jeff, and then Beth?
Yeah, it's a good question. I'm not sure if I flipped a coin which comes out better, COVID or fires. Neither are very fun to deal with, but sadly, because of what we're dealing with in this day and age, fires is something that as soon as the mountain shuts down, we kick back into fire mode and just kind of keep watches and get ready for that season. But and I can address some of those, some of the fire mitigation plans that we're working on and spending money towards that to try to protect our more populated areas. But on a much larger scale, Eagle County just this year has set up a new Resiliency Department. And in the past, what we've done is we've kind of looked at economic development or housing and then sustainability and through separate lenses. And what we've done now is combined all that. So as we hopefully come out of COVID and we begin to look at how do we begin to encourage and retain economic development and business development, as well as this housing conversation we just had. How do we do that with a lens of with our climate concerns, and not only from a global perspective, but even just locally, how do we begin to change how we do business and how we do things? And so that's really that's why we set up that department and have all those various programs within it. And it's not just those programs. It's that resiliency is something that we're looking at through our transportation, through RTA, through everything that we're doing at the airport, through our land use and planning files. Those are things that we're trying to incorporate all within that. And so, there's going to be, we were very fortunate this year, other than the outbreak of the Sylvan Lake fire. But after that, we had a pretty good rain and monsoon season that kept it in bay for in at least western Colorado. We have no idea what comes year to year, but I think if we don't pay attention to those things, we're really going to find ourselves on the bad end of not just fires, but it hurts our economy when we have low snow years. And then, what was more concerning this year maybe than the fires was just the condition and the quality of our water and our rivers. There wasn't any. I'm a pretty avid fly fisherman, and I just didn't fish from July to August, or through September actually, because it just wasn't healthy to be bothering the fish with high temperatures and low flows. So that's part of, I think, what's really we're working hard to embed that philosophy throughout every department with Eagle County.
Beth?
Hi, Markian. Under our Epic Promise umbrella, our commitment to zero, if you've heard of that, we just put out our Epic Promise progress report. And if you go onto our Vail Resorts website, it has everything we're doing across the entire enterprise. It's high priority for us. And we are on track to have zero net operating impact by 2030. That's our rally cry. And this progress report is showing that we're tracking in that way, and we're absolutely committed to delivering on that goal. So please look at that if you want to see the details.
Will, anything to add on this one?
Nothing new. Really for us, it's all about in new buildings, how do we ensure we're following lead and making sure that we're looking at alternative energy sources and things of that nature. So a similar sort of book of business for us.
Good. And I'm going to get some over here. Jennifer, I think. Hiding behind masks, it's hard to tell who everyone is. So. The customer service in the COVID environment, and how are you focusing on that?
Yeah, thanks, Jennifer. We acknowledge we had guest service issues, particularly on the refunds and all the new processes we rolled out with reservations and that, we were learning as we were going to. So we have put a significant focus on our call centers, technology behind the scenes this year to turn that around, because that's not what we aim for. And you can always reach out to me, Jennifer, because I don't want you to dread making that phone call. So, but thank you. We put a significant amount of effort into that to make that turnaround this year.
And we've got a few minutes remaining, so we're going to ask you guys to keep these answers short so we can get to as many questions as we can. Is that Corey? So how are you guys combating fake news?
You know,
I mean, that's kind of what she said.
I think it's not just fake news. It's just overwhelming with all this different news, and how do you make sense of it? And, we worked with Eagle County during the real heightened areas of COVID to try and make sure we were putting information out there, the tracker and all the rest of it. But I'll circle back with Michael Holton and Sally Welsh, who are on our team, to say, hey, what do we need to do to ramp it up? Is it mostly around the COVID topics, or is there more that you want us to focus on? Right. The question about the vaccine and can I get it now and should is another good example. So we'll try and hone in on the things that seem to be top of mind around COVID, whether or not it's testing, vaccines, what have you, and then keep an eye out towards other things that we can provide as maybe a counter to some disinformation, if that's a word.
And I would take the liberty to say, don't get your news from social media. Call a trusted resource, be that the paramedics or folks at the hospital, the county. There's a lot of resources out there around this topic that you can go to. Eagle County's COVID website is a great resource, but it's hard. It's really hard. Anyone else want to, Phil?
Corey, I would say that we try to keep an open door to meet with those who have misinformation or misconceptions about what the district is doing. So, for example, we hosted some meetings over the summer at our two big high schools to talk to parents about critical race theory. They were misinformed about what we were doing or how we were doing it, and brought them in and said, hey, let's hear your questions. So we keep an open door. We're infinitely invitational and want all the folks who have those conceptions to come in and talk to us so that we can explain what's really happening.
Okay. A question came in on the text from a viewer, and it's around vaccine requirements, right? So for the organizations that have chosen to have the vaccine requirements, and the federal guidance came out this week. So the federal guidance came out this week. I haven't had a chance to read through the dozens of pages there for employers over 100. But some of you, and Vail Health, I think, and Vail Resorts, among others in the community, have required vaccines for your employees. So the question is, what's the timeline, and what percentage of folks do you anticipate might leave?
Well, I can go first, since the Colorado Department of Public Health and Environment, which is our state regulatory agency, mandated it for healthcare organizations, and that had to be done, by the end of October, and the first shot had to be in the arm by the end of September. And so, thankfully, a lot of our providers and staff had already been vaccinated. We were already above 90%. But there was about 30 or so folks who inevitably left the organization prior to, because they chose not to get vaccinated, and there was about 30 or so folks who had to be put on unpaid leave, and so that's 60 or so people on a denominator of 1,400. You can do the math, and it's an unfortunate situation. But carry the two.
Carry the one.
But suffice it to say that yes, there will be fallout for when it does happen. At least that's been our experience to date.
And Beth, how about you?
Our vaccine requirement for employees goes into effect November 15th. So fully vaccinated by November 15th. And we sent that communication out in September to hopefully give everyone enough time to do that. So that's new for us this year.
Yep. And others in the community too. I don't know if Phil or Jeff have anything to add on that one. We have time for another quick question or two. We've got right here. Yeah, communicating with the Latinx community. Will.
Yeah, sure. Well, we do a lot of things. Number one, almost all of our advertising communications are also done in Spanish. More importantly, we work with the Mirror Bus, this wonderful Eagle County community asset, to ensure that we're going out to those communities to not only avail to them the resources that are available, but how they access them. If they can't afford them, how we give it to them for free. We're trying to get to them as well through churches and through their places of work. There's a lot of cultural gaps in how healthcare gets utilized, and a lot of distrust, especially if you have to give information in order to qualify for certain healthcare, and they're concerned about documentation issues. And so we're doing as much as we possibly can. We've actually started to ensure that in all of our key positions, especially healthcare navigator positions, that you must be bilingual. We've tried to put more representation of the Latinx community on our boards and our management team, but it still isn't enough, and I think it's more that we can and should do. And if any of you have any other ideas of ways that we can improve it, we are all ears, because again, they're a third of our population and a really important component. All of us are important, but they're especially important because they're the most vulnerable in many ways. So, and if I've missed anything, Sally, maybe we can follow up directly afterwards, but that's what we're doing to date.
And there's a great partnership between Eagle County, the Community Foundation, and Vail Health for the Mirror Bus, which is a huge impact. And if you talked about that, I'm sorry.
No,
but
I should have said
it's a
Community
huge
Foundation.
outreach to the entire community, but especially those most vulnerable populations. So,
Yes, I did, and I left out the
and thanks
Community
to Eagle
Foundation.
County and Vail Health. We've got one back here. If you promise to be super quick, we can get both of them. Lisa. So the answer to that is yes. Thank you for being brief. Right here, and this will be, and then I have one question for you guys, and we'll wrap up. Yeah, a specific timeline will give you guys the opportunity to be really concise with this. Phil already said 18 months, so thank you for the specific time frame for the Edwards project with others down the road. Will, how about you?
Plans moving now, probably not open and available for 2 to 3 years, because we are behind, Phil, if I'm being realistic, not including master lease increases as they build out Hawkett Gulch over in Eagle and all the rest of it, but even they have to build, and that's 18 months away. So I'd say 2 to 3 years if I'm being realistic.
It takes a long time to get through the planning phase and everything else. Jeff, I don't know that this is anything for you to add on. What are you doing maybe to streamline approvals and things?
Well, I think that is a conversation as we rewrite our land use regs as to how to streamline, particularly projects that are, related to affordable housing. We're in the same boat as Vail Health. It's going to be 2 to 3 years. On vertical stuff, I think we are being a lot more aggressive and starting right now in terms of acquiring things that are out on the open market and transferring those into affordable housing.
Yeah, deed restrictions and ADUs and other things the county is leading on. Beth, how about you? No time frame. There's similar to Will. Okay, my last question for you guys, and then we'll wrap up. What do you think? And keep it brief, please, in the interest of time. What do you think we'll be talking about 1 year from now? We'll start with Phil and we'll work our way to Beth. What will we be talking about 1 year from now? Brief.
If you asked me that a year ago, I would have been 100% wrong. So I have no idea.
This is being recorded, so we'll bring it back in a year and see if you were right.
Yeah, my hope is we talk about resilience, we talk about progress, and the continued advantages of what it means to be in Eagle County, and that's the collaborative relationships that we all have, the relative level of civility that we've enjoyed in this community compared to some others. So I hope we can continue to rely on those pieces, and that we show progress and resilience.
Will, what will we be talking about 1 year from now?
Hopefully progress on everything you heard, from affordability of healthcare to housing and daycare, but I think also how we've shifted from a pandemic to an endemic.
Jeff?
Amen to that one. I'm actually hoping a year from now we'll be celebrating the passage of an RTA question for a much more robust bus service in the Valley. Hopefully you'll see some construction on the last few sections or last few miles of the core trail that'll finish the whole trail program across the county. We hopefully will have that under construction, and certainly hoping to not be talking about it COVID as much, and having some, seeing some, vertical construction addressing affordable housing, and I echo. I hope there's just some energy and some civility, and just neighbors being kind to one another, and from all walks of life, no matter where you live or what you believe in, and we'll keep that momentum going.
And Beth?
Vail's 60th anniversary is next year. I hope that's what we're
Perfect.
talking about, and I hope we're talking about not downloading on Gauntlet One on opening day.
Yeah, that's a great thing to close on. So thank you to all of our panelists for taking the time today. Thank you to everyone in the audience for taking the time today. For those who tuned in, on behalf of the symposium and the partnership, we appreciate you guys. We thank you guys. And again, thanks to our panelists, and thank you guys. And sorry, Chris.
I just want to add, thank you all for coming out, but this panel did a great job. We did a program a few weeks ago on disaster preparedness, and between that program and this program, we are very fortunate to live in this community. We record almost all of our programs, so if you want to share this one, it'll be up in a week or so, but if you want to go back and look at the disaster preparedness, which would also make you feel great about living here, that is up on our website. Thank you all.